Good morning, this is Anita with the Lewis County Health Department. I wanted to come to you today to give you a little update on COVID-19 and where we're at in Lewis County. We still are holding at only 2 cases that are confirmed. The first case has completely recovered, I'm glad to say. The second case is at home, reports is feeling much better and is still in isolation. I don't want you to get a false sense of security about that because, again, those were the only 2 confirmed cases. We do expect more, especially now that testing is getting more available to us all. So I do expect more cases. And I wanted to thank folks that are doing everything right. When I go into the local grocery stores and the other retail stores here, I see where the store managers and employees have put the marks on the floor. They're measuring 6 feet apart so we can stay 6 feet apart as we're waiting to check out. I see folks wearing masks. I don't see them in the aisles talking and chatting. I think folks are trying their best to do what we ask them to do, and we so appreciate that because this social distancing and staying apart from each other is the way we're going to defeat this virus, and you folks are the ones that are help flattening this curve for sure. Sunday, my husband and I, we went through a drive-in service. We go to the First Baptist here in Vanceburg, where they have had several drive-in services. When we come back, that's all we saw was people having drive-in services. And I want to thank the pastors of those churches that are doing that correctly and taking very special care of their parishioners. And I know we all have folks in those churches that are in that high-risk category where they are over 60 and they have other health conditions. And it's so important that we take care of those folks because that's just what we need to do, and we've always done that. As I've said before, Lewis County's always been good neighbors, and I want to thank those people so much that are doing their best to take care of their parishioners. I wanted to talk a little bit about what we're doing with our community partners. We are meeting on a regular basis about things that are important in the community, and we are planning for this COVID when we do get more. We are trying to get education out there for people. We're answering questions. We have stockpile of PPE that we are getting out to the people who need that, our first responders and our medical folks. I want to talk a little bit about the nursing home. I talk almost daily with folks there at the nursing home, and I want to talk about what a good job they're doing. There is no reported cases currently in the nursing home, and they are doing such a good job taking care of our very special elderly population there. They are doing very creative things as far as activities, the in-room activities that they're doing. I think when you sit and all you can do is stay in a room and watch TV and you get inundated with this COVID-19, and they are doing their best to keep their minds off of that. They're offering e-cards. They have the ability to do FaceTiming. If you have a loved one there at our local nursing home and you want to FaceTime them, just call them and they will arrange that happens. We talk, like I say, we talk with them daily. We are working on getting them some more PPE. They have plans in place, and I'm impressed with their ability and their staff. Their staff wants to do the right thing. They want to take care of those very precious patients of theirs, or residents. And I want to talk a little bit about how difficult this is on everybody. I have not seen my grandchildren in 4 Sundays in a row. And I know, yes, I FaceTime, but, you know, I want to touch them. I want to hug them. I want to love them. But I have one grandson that's medically fragile, and just one hug could give him this horrible COVID-19 virus, and I just can't take that chance and would never take that chance. Where he is medically fragile, I don't know if he would be able to survive that virus. So I would certainly not do that, and I know that's what you folks are thinking about. As hard as it is to stay away from our loved ones and our grandchildren, we do that because that's what's best for them, as we often do things. That's what's best for our grandchildren, whether it's popular or not. I want to remind everybody that if you have any questions, anything the health department could do for you, please give us a call. We'll be glad to do anything we can for you. Thank you.